This Health Ranger Report Pandemic Podcast is brought to you by NaturalNews.com for uncensored reporting and HealthRangerStore.com for lab-tested preparedness supplies such as storable food, full-face medical masks, biostructured silver first aid gel, and iodine, only while supplies last. All right, we're going to get into projections of where things are headed in the United States with this pandemic.news update. This is Sunday, March 29th. And I just posted an article on Natural News that gives updated projection numbers. We are currently projecting that for the calendar months April, May, June, and July, we will see between 45,000 and 90,000 coronavirus-related fatalities in the United States. And I find it interesting that Dr. Fauci is currently estimating 100,000 to 200,000 deaths from the coronavirus in the United States, although it wasn't clear what time frame he was referring to. In any case, I'm estimating 45 to 90,000, and I lay out the logic for it in a rather detailed article there on naturalnews.com. The reason this is important is because it's only the first wave. So in the first wave of this, we'll lose 45 to 90,000 people. The second wave or the third wave could be either much better or much worse, depending on what we do as a society. Now, here's the good news in all of this. We're not going to have millions of deaths by July, even though originally we had projected we would hit 2 million deaths by early July if we did not engage in any kind of mitigation procedures, such as lockdowns and social isolation. So if we end up with only 100,000 deaths by early July, we will have prevented 2 million plus deaths. And that speaks to the wisdom of the lockdowns. And, even give Trump a little bit of credit, even though he was very late in all this. He did block flights from Europe, and he blocked incoming flights of Chinese nationals from Wuhan and so on. But he was very late to acknowledge that this was a real thing. He was telling us when there were 15 infections that this would just vanish and it would disappear and everything was going to go away. And that's not what happened. We're at 135,000 infections now, and it just keeps growing. So it's good that he came around and is now considering even more aggressive lockdowns, enforceable lockdowns in New York, New Jersey, Connecticut, and those areas. We'll see what happens with that. But we're going to have April will be a lot of deaths, tens of thousands in April. May will be a lot of deaths in the later cities. So April is going to be deaths in New York City and areas of New Jersey and the Northeast and sort of the early cities. May is going to see a lot of deaths in New Orleans and Atlanta, Chicago, Detroit, Denver, Dallas, San Francisco, maybe even Portland, Seattle, of course. And then June is really tapering off, and July is strongly tapering down. But this is all based on the social isolation lockdowns continuing in the United States for quite some time. If the lockdowns are ended early, let's say if Trump says, we want to get everybody back to work by Easter, which is something that he has said. If you sort of end the lockdowns and put everybody back to work by Easter, then things will look fine for about 30 days. But during this 30 days, the infected people are spreading it through workplaces. So you'll have clusters and then explosions in mid-May and late May and June and so on. So in other words, if you end the lockdowns prematurely, you can fool yourself for about 30 days into thinking, everything's fine. We don't have huge increases. Everybody back to work. But that's because you're reigniting the exponential spread of the virus through the workplaces. And so you can end up in June and July with a whole new wave if everybody's back to work by Easter. So that's why my projections here are really dependent very strongly on what happens with the lockdowns. And I've also said in this article that when the lockdowns end, whenever they end, and they're going to end probably at different times in different cities, when the New York City lockdown ends, for example, which might happen in late April, it's crucial that anybody who leaves the lockdown and goes back to work, that two things happen. Number one, they need to be tested. And number two, they have to wear a mask. So everybody's got to start wearing masks. And this needs to be enforced socially, if not through law enforcement. Masks for everyone, which means we have to make masks available, which means we have to be manufacturing masks. Otherwise, that policy is impossible. Secondly, everybody's got to be tested. And the way to test people is to have, of course, more testing kits manufactured. And everybody's got to be tested before they go back to work. And the best kind of test is an antibody test, which is a blood test, not just a nasal swab. An antibody test actually tells them whether you have had it and maybe you've already recovered from it and you're no longer infectious, but you've already had it. That would mean that you could serve as a frontline, first line responder, for example. You could be on the police force or a firefighter or an EMT. You could respond and you could deal with the public because you've already been infected. You already have immunity. And in fact, one of my predictions is that in New York City, where you're having a lot of police already infected by this, pretty soon, you're going to have post-exposure police teams and pre-exposure police teams. So you don't want to partner up a police officer who's already had the infection with somebody who hasn't yet had the infection. If you're going to move around the city in teams of 2, you want both of those police officers to have the same status. So they've both already been infected, for example, then they could respond to calls of people who might be infected without fear of the officers becoming newly infected. And the same thing's probably true with doctors and nurses and so on. You're going to have medical staff who are post-exposure, post-infection doctors who have already overcome coronavirus with their own immune systems. Those doctors will be especially valuable because they can respond. They can be in the emergency rooms and in the first line treatment areas of the hospitals, and they can deal with infected patients without the risk of those doctors becoming reinfected. Now, I know there are some people who experience a subsequent infection, a secondary infection or a third infection that comes back. So that's worth an entirely another podcast. So I'm not going to discuss that now, but that is a possibility. I'm very much aware of that. And it does mean that even people who've already been infected might be reinfected at some future date. Nevertheless, in the big picture here, we're going to get through this first wave in the United States, it looks like, by June or July. By the end of July, probably through the first wave. However, whether the second wave happens depends on how we act in society. If we send everybody back to work without testing and without masks, there will be a second wave. And August will look like February. And September will look like March. And October will look like April, which is going to be a hell month. And that would mean that Trump absolutely loses the election in November because we'll be dealing with a second lockdown and a second explosion in October because we were foolish and did not get everybody tested and did not have everybody wearing a mask. So if we want to solve this for the sake of America and to keep everybody safe and also to have an economy working this fall and even to have elections functioning this fall, we've got to have everybody stay in lockdown until they're tested and until they wear a mask. And then we could maybe limit this to just the one wave instead of having a second wave. That's my take on it. But it's very likely we will not get through this with anything less than 45 to 90,000 deaths in the United States. And I have a feeling it's going to go over 100,000 actually, but my official projections are topping out currently at 90,000. But you should note that my numbers have been incredibly low this whole time. My initial projections are 2 weeks behind where we are. My model, revision 1 of the pandemic projection model. So things may be a lot worse than what I'm predicting here. Just giving you that as a full disclosure type of, heads up warning thing. So I hope I'm wrong. I hope that the numbers come in much lower. I hope that there is a miracle cure. I hope that people stay home and don't spread it to others. I hope that maybe the summertime weather just stops the virus in its tracks, but I'm not betting on that. I think those things are very unlikely to occur. So that's my best estimate, and I appreciate your interest in this. I appreciate you supporting our work. And I also want to say I feel very humbled that with your help, we have been able to raise the alarm. We were really among the very first people in America, the very first publishers to raise the alarm that has nudged mayors and governors into taking actions that have already saved 2 million lives in America. So yes, we here at Natural News and Pandemic.News and you by helping to support our work. You and us, we have been part of saving 2 million lives in America already. Can we save more? Yes, but only through the things that I've described here. We can save more lives, but this is why censorship is so dangerous to society. We should have been among the most prominent voices on Facebook and YouTube and Twitter, but we've been banned everywhere, so our message was censored while America was being lied to and told that this is no big deal. Had our voice been more prominent, we could have saved more lives. There is a cost for censorship, and that cost is dead people. And that's what has happened in America. And there's a cost for being slow when you're dealing with a pandemic. It's a very real cost. And Trump acted too late in many ways. And Fox News is still out there telling people it's a hoax. And many independent media operations were reporting pretty much during the whole month of March that they thought this was a total hoax and nobody was dying. Those actions got people killed. Those actions are dangerous for society. And if anybody has been accurate this whole time, it's us. We've been accurate and we've been consistent. We didn't change our opinion, didn't change our views. We didn't flip sides or anything. We've been accurate and honest and transparent from day one. So I thank you for your help so that we can get this message out. This is Mike Adams here, the Health Ranger, pandemic.news. Everybody wear a mask. Everybody stay home until you're tested and cleared. We might just get through this with possibly less than 100,000 deaths. Thank you for listening. When it comes to prepping, you not only need good products that can help keep you alive, awake, aware, and nourished during difficult times, you also need products you can trust. At the Health Ranger store, we do extensive laboratory testing using an in-house lab that's ISO accredited. It's inspected, it's audited. It's a 2-year process to even get that accreditation. We use multiple mass spec instruments, state-of-the-art science. I'm a published science author as well and a patent holder on several technologies, some of which we use variations of in our lab. The purpose of this lab is to help you make sure you get clean foods, superfoods, storable foods for emergency preparedness and survival use. We have a certified organic lab-tested, what's called Ranger Bucket collection of storable foods with some survival gear in the buckets to help you even boil water and cook those foods and so on. It's a fantastic product. We can barely keep it in stock even during normal times. In a crisis, we'll be wiped out of this product because it actually takes us a lot of time to make those products. But if they're in stock, you can get them now at healthrangerstore.com/prepwithmike. In fact, go to that URL, healthrangerstore.com/prepwithmike, and you'll see some of our survival and preparedness supplies, including iodine, colloidal silver products and gel first aid products, storable foods, superfoods, medicinal herbs for first aid, and much more. We have a lot of products for you to help you be self-reliant, to be safe, to survive difficult circumstances, natural disasters, and all kinds of things. If you want to get prepared, do it with us at the Health Ranger store so that you know you're getting safe, clean, laboratory-verified preparedness foods, supplements, and other related products. Again, the URL is healthrangerstore.com/prepwithmike. All one word, no spaces. Prep with Mike. I'm Mike Adams. Thank you for your support. Thank you for watching. If you want to support our mission, visit us at healthrangerstore.com for the world's largest selection of lab-verified superfood and nutritional products for healthy living. It's at healthrangerstore.com.